So, good morning, ma'am. So, I'm Anjik P. Cuba, and I'm from BSN 1A. So, I will be assessing the patient for the ear. So, I will be demonstrating the assessing of the ear. So, first, we're going to introduce ourselves to the patient. So, good morning, ma'am. So, I'm Anjik P. Cuba, and I will be your student nurse for today. So, I will be the one who will assess you on your ear. So, can you please state your name, ma'am?
Jaika Heartbeat Rachel,
Okay, so what is your age?
10,
So, when is your birth date?
June 2011.
So after that, we're going to explain the procedure that we're going to do. So the purpose of this ma'am is for us to be able to check or observe your ear if there are any abnormalities that we can see, and also if meron man, for us to be able to maagapan or give immediate care agad. Okay po? So after that, we're going to provide the patients with the privacy. So if the door is open, we're going to close it. So it is already closed. Also the curtains and window, if it is open, we're going to close it. So next, we're going to perform a hand hygiene. So after that, we're going to gather all the data, all the equipments that we will be needing. So I have here a watch with a second hand. So let's just pretend that this is a otoscope because I don't have that kind of equipment. And also the tuning fork. So let's just pretend that this is a tuning fork because I don't have any equipment. So prepare the client to a comfortable position. So nasa comfortable position naman siya. So next, we're going to collect or ask the patient some questions. So ma'am, I just have some questions to ask po. So I hope you can cooperate with me po. Okay po? So, is there any changes in hearing?
No.
Wala naman po.
No.
Okay po. So, other symptoms?
No.
Wala naman po. So, nagkaroon ka na po ba ng problem sa ears po?
No.
Nagka-infection na po ba yung ear nyo?
No.
Did you already have earaches?
No.
Trauma?
No.
Okay po. So, did you already had surgery sa ear?
No.
Okay po. Sa family nyo po, wala naman pong nagka-problema sa ear?
Wala po.
So, ilang, sa lifestyle and health practices nyo po, ano po yung, or ilang beses ka po kayong maglinis ng ear nyo sa isang araw po?
3 po.
3 beses? So next, so we're going to inspect the auricle, the tragus, and the lobule. So ma'am, I'm just going to inspect the auricle, tragus, and the lobule. Also note the size, color, and consistency. And also observe for any lesions, discolorations, and landmarks. So next, I'm going to palpate the auricle and mastoid. So I'm just going to palpate. So permission to touch you po. So touch ko lang po kayo, okay lang po ma'am. So I'm just going to palpate the auricle. So check for any tenderness. And also the mastoid. Palpate the mastoid. So normally, it has no tender. So wala naman akong nakita or na-observe na tenderness. So next, we're going to observe or inspect the client external ear or the external auditory canal. So using this otoscope, so let's just pretend that this is a otoscope. So I'm going to observe or inspect for the patient's auditory canal. Okay ma'am, so usually when assessing the adult, so adult na siya, so we're going to pull up the patient's ear and backwards. So we're going to inspect the external auditory canal. So note of any size, the color, and consistency. Okay, so both ears. And also, we're going to observe or inspect for the canal walls. So check for any color, size, and consistency, and observe for any consistency or discolorations of cerumen. So yung kabila naman. So observe also and inspect for the tympanic membrane. So check for any size, color, and consistency or discoloration. Okay. So now is we're going to perform the different tests in the ear. So first we're going to assess the patient with the whisper test. So ma'am, I'm just going to whisper something or words from your ear. So I want you to repeat it after me, okay po? So we're going to the patients behind. So 1 to 2 feet away. So ma'am, I want you po to occlude your one ear. Takpan niyo po, ganito po. Takpan niyo po yung ear nyo. Dito po, ganito po. Okay po. Sa last muna po. So, may sasabihin po ako tapos sabihin niyo po after ko masabi, okay po? So, thank you. So, can you please repeat it after me?
So, thank you.
Okay. So, yung kabila naman pong ear. God is good. So, can you please repeat it after me?
God is good.
Okay po. So, we are done with the assessing the patient with the whisper test. So, next is we're going to assess the patient with the Weber test. So, sit properly lang po ma'am. So, using this tuning fork is I'm going to vibrate it. So I'm going to place it to the patient's head. So tell me po ma'am if may naririnig ka pong vibration or na may nafe-feel ka po, okay po? So I'm going to vibrate this tuning fork. Then I'm going to place it to your head. So may nafe-feel ka po?
Yes.
May naririnig ka po?
Yes.
So both ears po?
Yes.
Malakas po yung vibration?
Yes.
Okay. Then, next is the mastoid. So, I'm going to place it to your mastoid, ma'am. So, tell me po if may nafe-feel ka po, naririnig, okay po? Ay, naririnig ka po?
Yes.
Okay po. Sa kabila naman, ay nafe-feel ka po, naririnig?
Yes.
Malakas po.
Okay.
So, after that is we're going to assess the patient with the Rhine test. So, sit properly lang po ma'am. So, using this tuning fork is I'm going to place it to the patient's mastoid. So, and also using this watch with a second hand, so we're going to count the duration if gaano katagal na nafe-feel or naririnig ng patient yung vibration ng tuning fork. So, tell me po ma'am if may narinig ka po or wala na. Okay po. So I'm going to vibrate this tuning forks and I'm also going to place it to your mastoid. Okay po. Narinig ka pa po? So we're going to count the duration. May narinig ka pa po? Wala.
Wala na po.
Okay, so note the time that we've gathered to the patient's mastoid. And also yung kabila naman. So, ma'am, I'm going to vibrate this. I'm going to put it in your mastoid. Narinig ka ba po?
Opo.
Narinig ka ba po? Wala.
Wala po.
Okay. So after that, we're going to assess the patient with the Romberg test. So, ask the patient to stand. Ma'am, can you please stand po? Wait lang po. So, can you please close your eyes? I want you to put. Then, put your hands beside your hip. Ganito po. Okay po. So, using this watch with a second hand is we're going to count for 20 seconds. So, we're going to check for the patient's weighing. So, now is we're going to assess or test the patient with the Romberg test. So, okay po ma'am. Start na po. So, normal people sway. So, swaying is normal for the people when we are assessing the patient with the Romberg test. So, okay na po ma'am. You can sit na po. So, after that, we're going to validate. But first, we're going to aftercare. So, we're going to gather the data that we've used. So next, we're going to validate or document all the data that we've gathered to the patient. So if ano yung ating ginawang procedure, so we need to document it because if you don't document, it is not done. So if may na-observe tayong abnormalities sa patient's ear, we need to document it. So we are done with the assessment or assessing the patient with the ear. So that's all. Thank you. So that's the return demonstration of assessing the patient ear. Thank you.